Hello, my name is Mikayla Thomas, and I decided to do my final project on Parkinson's disease. So, Parkinson's disease is a neuromuscular disease that it has very negative impacts on both the brain and the muscular system. So, this consists of nerve cell damage that leads to a drop of dopamine production in the brain. And as these brain cells weaken, become more damaged, or even die, these patients with Parkinson's will experience numerous problems, such as trouble moving, so shuffling of the feet, tremors within the hands, stiffness in the limbs, such as bending of the knees, and impaired balance. Some underlying symptoms of Parkinson's, other than the four that I just named, there are a whole lot of other issues that will arise if you have Parkinson's disease, such as depression, difficulty swallowing, which will lead to an insertion of a feeding tube, changing of speech, so going from talking a lot and normally to talking very little to talking very blurred and then not talking at all towards the very end. And then also urinary issues and constipation. So once your disease progresses to the very end, you will no longer be able to walk and obviously be unable to walk yourself to the bathroom. So you will need to be in diapers and be changed. But this also comes with dementia, hallucinations, and muscle pain and cramps. But something to note about Parkinson's is that it affects every person very differently. Which gender does Parkinson's affect more? So, biological sex of the patient is a very key component of Parkinson's disease. According to the journal Parkinson's Disease, one of the articles that I chose for this final project, it stated that men have twice the higher rate of developing Parkinson's compared to women. But women do have a higher mortality rate, which means they'll die faster than men and also have a faster progression with Parkinson's disease. So this disease will deteriorate their bodies very fast compared to men. And female patients with Parkinson's have been overlooked by research just because the fact that women do not usually get Parkinson's, but it's not uncommon. But also another thing to think about is the treatment for Parkinson's disease, which I'll talk about in the next few slides. But treatment for Parkinson's will affect male and female patients very differently. So some of the risk factors for Parkinson's, it can be hereditary in some cases. However, it also can be developed through genetic mutations. It can run through families, but it typically doesn't. It's just something that develops within your body, and the cause of Parkinson's disease is currently undetermined. We have no idea why Parkinson's happens in people, which is very unfortunate because this is a very horrible disease. Who will be affected by Parkinson's disease? So age, it usually happens at the age of 70 and usually becomes very bad as the patient gets older. You could become at a greater risk. Biological sex, like I said, affects men way more than it does females. Back to the hereditary part of it, close relatives who have suffered from Parkinson's disorder can usually have an increased risk of developing this disease, but like I said, it can be developed through genetic mutations. And I thought this was really interesting that pesticides can also increase someone's risk of developing Parkinson's disease. So these are just three visual examples of Parkinson's. The first one being the symptoms, the second one being the stages, and the third one just being the dopamine pathways of the brain. So this guy in the first picture you see, he has a very masked face. His arms are very swingy and just lousy. He has tremors within his hands. His knees are flexed. He has a very stooped posture. Like I said, Parkinson's does affect everyone very differently. However, the stages of Parkinson's are usually the same with everybody. So the first stage usually is you develop these symptoms, but you can still live your day-to-day life. The second one being you see the tremors and the stiffness begin to worse. And the third one being movement begins to slow down and you have a loss of balance. So usually a cane or some sort of balance tool can really help you. And then stage 4, you can have significant issues with living day to day and you can't live alone, you need self-care. And then 5, you will not be able to walk at all. And then the last one is just talking about the dopamine pathways. So treating Parkinson's disease. So there's no cure for Parkinson's, unfortunately. However, medicines and surgery can reduce the symptoms over time. So medications can be used to improve the motor skills of the patient. However, it will not last forever. The symptoms of Parkinson's will significantly improve using drug therapy or surgery, but these symptoms will come back in the near future as the disease continues to progress and takes over the patient's body more severely. But going back to the medications, they're fit into 3 different categories, one being the drugs that increase the amount of dopamine in the brain, 2 being the drugs that affect other neurotransmitters in the brain to limit the overall symptoms of Parkinson's, and the third being medications that help improve non-motor skills that are related to Parkinson's disease. Some of the non-motor symptoms that are related to Parkinson's could be an example of depression. Depression is non-motor, and you could be prescribed antidepressants for that, so that would be a medication. There's 2 surgeries that involve destroying parts of the brain, but they are 2 different parts of the brain for each surgery that you're destroying, but they both reduce the tremors and you can regain some motor skills. So the first one, you're destroying the globus pallidus to regain motor skills, and the other one, you're destroying a part of the thalamus to reduce the tremors and gain back some motor skills. The quality of life in Parkinson's patients. So patients that have been diagnosed with Parkinson's, they do suffer a lot from this disease. Their lives have forever been changed now that we know that this is a non-curable disease. Knowing that is very scary to these patients, and this can impact their physical well-being, emotional well-being, and social aspects. They can go from walking every day to being bedridden for the rest of their life. They could be super happy all the time, but now they're super depressed and anxious. And the social aspects could be being around a whole bunch of family all the time or talking to neighbors, but they can't do that anymore as the disease progresses. But family and friend support is super important to these patients. So the support aspect, this disease is very isolating, which can cause more depression in these patients. Like I said, quality relationships with friends, loved ones, relatives, neighbors, etc., can help tremendously in these patients at the very beginning. As the disease progresses, it can get embarrassing for outside people, like neighbors, for example, to see their neighbor looking like this, eating baby food instead of actual like human food, and being in diapers and not having any more communication skills. Just stuff like that can be super embarrassing to these patients. But also their anxiety and depression towards the beginning can also lead to anti-socialization. But the communication skills are a huge part of this, and they'll be unrecognizable towards the very end. But another part of what I wanted to talk about was that this disease can be super tough on the patient's caregivers, which usually are their husbands or wife. So sharing coping skills amongst people that have also suffered the same thing, investing in self-care for yourself because you also matter, planning ahead for like funeral homes and grave sites and all of this stuff that you need to plan for when they do end up passing away, unfortunately. But also spending time with loved ones, like I said, is very important, and spending time away from your significant other can also provide benefits. So I do have a personal experience with Parkinson's disease. This is my grandfather, Ray. He was a very upbeat guy. He was such a fun guy to be around. He loved NASCAR and cars and building stuff and painting and being with his grandchildren and just spending time with the family. Like, he was just a overall great grandfather. Like him and my grandma were like superheroes. Um, Unfortunately, all of that changed once he was diagnosed with Parkinson's. So he was diagnosed at the age of 71 years old with Parkinson's. It did run in his family, so it was hereditary on his mom's side of the family. His brother also died from Parkinson's. Um, Before he was diagnosed, we noticed that he was very shuffly in his feet, like he would like almost never lift up his feet. He would be very dazed, very like trembly, and had tremors in his hands, and he acted like he had no idea what was going on, so that would be dementia. Um, it all started when he went to the hospital for gallbladder issues, and they removed his gallbladder, and unfortunately, he was also at the same time diagnosed with Parkinson's, and he was in the hospital for weeks, after this, after recovering from the gallbladder, but now ending up having Parkinson's disease also led to him being in the hospital for weeks. But he got sent home on hospice at home care for the rest of his life. But after he was diagnosed, it happened very fast. And I have never seen my grandfather look like this, which is like the saddest part of it. He was unfortunately skin and bone, since his feeding tube, like he was only allowed certain fluids and he couldn't have actual food anymore. He could have soft food such as baby food, but also seeing him in a diaper, and he wasn't allowed to sleep in a regular bed. He had to sleep in a hospital bed, and he couldn't talk anymore. He couldn't walk. He couldn't go anywhere. It was just very sad to see him dying like this, and the support that we had from their their neighbors and my family and my family's friends, it was just incredible to see the amount of support, and people would bring us meals, and just the support that my grandma had from my mom, my dad, and my uncle were very helpful to her. Unfortunately, he passed away in the middle of the night a couple of years ago, and he just did not look like himself. Like this Parkinson's disease really destroyed him. But thank you for listening.